Hey there, and welcome to the Deep Dive. We've got a really fascinating and pretty timely topic today, gaming disorder. You brought us a stack of material digging into, what it actually is, maybe how common it is,
Mm.
what factors seem to play a role, how we even measure it, and, well, what we know about helping people.
Yeah, absolutely.
This feels incredibly relevant, especially for anyone listening who's in healthcare or mental health. I mean, gaming is everywhere now.
It really is. And this dive, it's specifically put together for you, thinking about what you, as a medical professional, might need to know if you encounter this. We're going to try and sift through all this information and pull out the really key insights.
Right. Think of it as your quick guide to getting up to speed on gaming disorder based on what you wanted explored. It's definitely complex. It's still evolving.
Hmm.
There's a lot of nuance here. Let's unpack it.
Okay, so first things first, let's clarify what we're actually talking about. How is gaming disorder defined? It's interesting because it shows up in both main diagnostic
Oh,
systems.
right. DSM-5 and ICD-11.
Exactly. In the DSM-5, it's listed as Internet Gaming Disorder, IGD, but it's in Section 3, which means, it's considered a condition needing more study.
Okay, so noted, but maybe not fully cemented there. And the ICD.
In the ICD-11, it actually has formal diagnostic status, so slightly different standings, but it's definitely on the map in both.
Got it. So if it's on the map, what are the core features? What actually is this pattern of behavior we should be looking for?
Well, the core idea is a persistent pattern where someone essentially loses significant control over their gaming. The key things are impaired control. They find it really hard to manage or stop gaming.
Okay.
Gaming takes on increasing priority, pushing out other interests, other activities.
Right, overshadowing things.
Precisely. And crucially, they keep gaming or even game more, even when negative consequences are happening because of it.
And is there a time frame? How long does this pattern need to go on for?
Generally, yeah. For a formal diagnosis, usually the pattern needs to be there for at least 12
A
months.
full year.
But the criteria do allow for a shorter period if the symptoms are really severe and causing significant problems.
Okay. And how does this actually look in someone's life? You mentioned impaired functioning. What does that mean practically?
It means that gaming causes real significant problems in important areas. We're talking personal life, family, social stuff, school, work.
The big things.
The big things, yeah. You might see someone playing games so much they miss out on other stuff, social events, maybe job opportunities. It can mess with basic self-care too, like sleep, eating, even hygiene.
Wow.
Real-world social interactions can suffer, or they might neglect major responsibilities, schoolwork, job duties, even looking after kids.
That sounds pretty disruptive. What about the emotional side? What's going on for the person experiencing this?
Yeah, there's often a strong emotional piece. They feel unable to control the gaming, like we said, but also experience intense negative feelings, maybe irritability, sadness, just profound boredom when they can't game.
So the absence of gaming becomes really difficult.
Very difficult. And the material also mentions the sort of fear of missing out FOMO, specifically related to the online game world. That can be powerful, especially if that's where they feel most competent or where their identity feels strongest.
Right, where their sense of self-efficacy is tied up.
Exactly. And another thing often noted is deception, hiding how much time they're actually spending gaming from others.
Okay, so it's definitely way beyond just enjoying games a lot. It's when it really disrupts life and well-being. Given that, let's talk numbers. How common is this? Prevalence seems like a really thorny issue here.
It really is. So there was this one big meta-analysis looking at studies between 2009 and 2019. Huge sample, over 226,000 people, 17 countries.
Okay, pretty comprehensive. What did it find?
It came up with an overall worldwide prevalence estimate of around 3.05%.
3% globally.
Ish, exactly. But, and this is a big but, the same analysis pointed out that when they only looked at studies using more rigorous sampling methods like proper stratified random
The
sampling,
gold standard stuff.
right, that adjusted estimate dropped quite a bit, down to 1.96%.
Wow. Okay, so nearly halved just by looking at the better quality studies.
Yeah. And maybe even more importantly, the analysis showed huge variability in the estimates from study to study. Massive differences.
Why? Why such big swings in the numbers?
Well, the data suggests a few key things predict these higher estimates. The absolute biggest factor explaining something like 77% of the variance was the assessment tool used.
How they measured it.
Exactly. Certain tools they mentioned, the Lemens IGD-9, the Gaming Addiction Identification Test, some problematic video game playing scales, these were consistently linked with the highest prevalence figures.
So literally how you ask the questions drastically changes how many people seem to have the disorder. That's critical for clinicians to understand when interpreting this stuff.
Absolutely critical. It means, if a patient mentions something they read or if you use a specific screener, the result could be heavily influenced just by the tool itself. Age was another big factor. Adolescent samples always showed higher rates.
Teenagers.
Yeah.
Makes sense, maybe.
Yeah. One review just looking at school-aged kids and teens, studies from 98 to 2016 reported prevalence ranging from 0.7% all the way up to 50%.
50. 0.7 to 50%. That's not a range. That's almost meaningless.
It really highlights how sensitive these numbers are. Sample size mattered. Two smaller studies, convenience samples, tended to get higher numbers than big representative surveys.
Okay.
And where the study was done, Asian countries often showed higher prevalence, like a pooled rate of 6.3% in one subgroup analysis.
Is there a clear reason for that regional difference?
Well, they suggest a few possibilities. Maybe cultural factors, the massive gaming market and, intense gaming culture in some parts of Asia, environmental factors, but also potentially issues with the assessment tools used there or non-random sampling methods perhaps inflating the numbers.
Okay, so multiple potential layers there. What about gender differences?
Pretty consistent finding there. Higher rates in males. The ratio mentioned is about 2.5 males for every one female identified.
Right, so summing that up. Higher in males, higher in adolescents, heavily dependent on the measurement tool and maybe the region. But did the overall rate actually go up over time as gaming just exploded?
That's a really interesting point. One review, looking at that 1998-2016 period, actually suggested that despite the huge increase in internet and gaming availability, the average prevalence across all these studies didn't really show a significant upward trend.
Huh. That is surprising. You just assume more access equals more problems, but maybe it's not that simple.
Doesn't seem to be a straightforward correlation, no.
Okay, let's pivot then. We've talked about what it is, how common it might be. Let's talk why. What contributes to someone developing gaming disorder?
It's definitely seen as a complex interplay, not just one single cause. The material kind of breaks it down into three interacting categories of factors.
Okay, category 1.
First up, gaming-related factors, so things about the games themselves. Certain genres pop up more often in connection with problematic gaming.
Which ones?
Things like massively multiplayer online role-playing games, MMORPGs.
The big online worlds.
Exactly. Also, first-person or third-person shooters, FPS, TPS, real-time strategy games, RTS, and multiplayer online battle arenas, or MOBAs.
Why MMORPGs in particular? What makes them potentially risky?
Well, they often have these persistent virtual worlds, right? They keep going even when you're offline. There are complex quests, social systems, long-term goals. It fosters this deep engagement, maybe even a sense of obligation to be there.
Right, keeps you hooked in. And shooters or MOBAs.
Those often involve intense competition, maybe rapid reward cycles. MOBAs especially rely heavily on team dynamics, which can create social pressure to play, to perform. But it's not just genres, it's also structural stuff in the games.
Like game mechanics.
Yeah, like reward systems, especially those intermittent, unpredictable rewards or metagame rewards outside the core gameplay. Features that demand huge time sinks, like trying to get 100% completion or master really hard skills. Even things like loot boxes and other monetization techniques, they're sometimes linked to problem gambling behaviors.
So the design itself can absolutely pull people in. Sometimes too much. Okay, what's the next category of factors?
Individual factors. This is about the person. Demographics we touched on, male gender, being an adolescent. There's also a suggestion that starting gaming really young might be a risk factor.
And personality.
Psychological traits.
Oh yeah, huge area here. Impulsivity comes up again and again. It's consistently linked, whether it's a general trait or measured in experiments. It relates to difficulty with decision-making, reining in urges.
Makes sense. What else?
Other things often associated are loneliness, low self-esteem, feeling less capable in the real world, low self-efficacy, and just general low life satisfaction. Also, why someone games matters.
Motivations.
Right. Using gaming to escape or for social connection, maybe as a coping mechanism to develop skills, live out fantasies, compete. Some of these motivations, especially using gaming as a dysfunctional coping strategy, are strongly tied to GD symptoms.
Okay.
Maladaptive thought patterns are also part of this picture.
And it sounds like other mental health conditions often go hand in hand with GD. Very much so. The data shows strong links with comorbid conditions, depression, anxiety disorders, ADHD, sometimes aggression, or issues with violence.
Is there a biological angle too? What about neurobiology?
Yeah, there's research using brain imaging PT scans, fMRI. It suggests gaming disorder might share some underlying neural pathways with other impulse control issues and addictions.
Like substance use?
Potentially, yeah. The dopamine system, key for reward and motivation, seems involved. Studies show altered brain activity and connections in areas important for impulse control, like parts of the prefrontal cortex, but also regions involved in attention, emotion regulation, like the amygdala and insula, and reward processing pathways. Changes in how the brain uses glucose in these areas have also been observed.
So a potential biological vulnerability interacting with everything else. What's the third category?
Environmental factors. This covers things like family dynamics, dysfunctional family relationships, maybe excessive parental control or interference, poor communication. These are linked, especially for adolescents, sometimes interacting with things like academic stress.
What about peers? Is it about isolation or...
That's an interesting point. The stereotype is often isolation, right? But the material actually highlights that things like attending offline game clubs or having memberships can be risk factors.
Wait, so being more social within gaming could be a risk factor?
It suggests that many people with GD do have social connections, but those connections might be heavily centered within the gaming world itself, kind of challenging that simple isolation idea. School factors, academic pressure, those are also mentioned as environmental influences.
And the broader culture?
Yeah, we touched on this with prevalence. The wider context, like a huge, intense gaming culture, as seen in some Asian countries, that can definitely play a role at a population level.
Okay, so it's genuinely a mix. The game, the person, the environment, all interacting. That complexity must make assessment incredibly difficult.
It really does. And that's a major theme. Inconsistent, sometimes inadequate measurement is a huge challenge, both for researchers and clinicians. There's just so many different assessment tools out there.
We saw some names mentioned earlier when we talked about prevalence varying so much.
Exactly. And the crucial thing is these tools differ quite a bit in how well they actually map onto the official diagnostic criteria in the DSM or ICD.
So they might be measuring slightly different things or have different thresholds?
Precisely. And that directly impacts the prevalence rates you find and how accurately you identify someone who truly meets the diagnostic criteria. You know, a quick screener might not need to cover everything, but for a clinical diagnosis, that precision really matters.
Are any tools considered better or more reliable than others? Is there a gold standard?
Well, some definitely have more research backing their psychometric properties. Tools like the GA7, IGDS-9SF, IGDT-10, YDQ, the Lemons, IGD-9, these are noted as having relatively stronger support. But the material is pretty clear. There isn't one single tool that's universally seen as the best for all situations. Many have limitations, especially lack of testing in real-world clinical settings versus just research groups. And different research teams often favor specific tools, maybe for specific types of studies.
So this fragmentation in measurement makes it really hard to compare results across studies, doesn't it?
It certainly complicates things when you're trying to get a clear, consistent picture of GD from the literature. Yeah.
Okay, so if assessment is tricky, what about treatment? Given this is relatively new as a focus area, what does the research say about effective interventions for gaming disorder?
The picture here is, well, it's still developing. Honestly, relatively little is known for sure about how effective different interventions are. We need more robust findings.
What approaches have been tried?
A range of things. Psychological therapies, especially cognitive behavioral therapy, CBT, sometimes in groups, sometimes with mindfulness elements added.
CBT makes sense, tackling thoughts and behaviors.
Right. Family therapy, including multifamily group therapy, has also shown some promise, particularly with adolescents. That likely ties back to addressing those family dynamics we talked about.
Okay. Anything else?
Even things like virtual reality treatment programs are being explored. And then there's the medication side.
Are drugs used?
Some studies have looked at medications, often ones used for common comorbidities like depression, anxiety, ADHD. There was one mention of bupropion showing some early positive signs.
Okay.
But the main takeaway is a strong call for more, much better designed medication trials, especially needing proper control groups to really know if the medication itself is having an effect.
So for both therapy and meds, the evidence is still pretty preliminary.
That's a really important point from the review, yeah.
Okay.
The treatment studies we have so far often have issues like using inconsistent ways to even define the diagnosis to begin with.
Right, back to the measurement problem.
Exactly. Many studies don't properly check if someone actually stops meeting diagnostic criteria after treatment. or track them long enough to see if they relapse. Follow-up periods are often way too short.
So we don't know about long-term recovery.
Not really. And what they measure after treatment is often limited just symptoms or how much time they gain. They don't always consistently look at broader things like, is their overall functioning better? Is their quality of life improved? Which arguably are the more important outcomes.
I feel like I've heard about treatment camps, particularly in Asia. What's the story there?
Yeah, those exist in some Asian countries. They often use a mix of therapies group, individual, family, plus physical activity, maybe psychiatric assessment, meds for comorbidities.
A kind of intensive multimodal approach.
Right. You sometimes see estimated success rates mentioned, but the material points out that most lack formal, rigorous evaluation. There's often no solid long-term follow-up data, so it's hard to scientifically say how effective they truly are.
So, bottom line on treatment, a real need for more high-quality research. Where should that research go?
The big push is for well-designed clinical trials with enough participants to get reliable results. One suggestion is adapting treatments we already know work for other addictive behaviors like substance use disorders and testing them carefully for GD. Prevention is also highlighted programs aimed at parents and caregivers.
This whole discussion about the evidence, the measurement issues, it brings us right back to that fundamental debate. Should gaming disorder even be a formal diagnosis? What are the arguments for being cautious?
Yeah, the material definitely presents that side. The argument is that the bar for creating a new formal diagnosis should be set really high. Why? Because there are real risks.
Risks like?
Potential for the diagnosis to be misused for people who just game a lot but aren't functionally impaired to get stigmatized.
Yeah.
And this idea of diagnostic inflation, where normal behavior starts getting labeled as a disorder.
And does just slapping label on it automatically mean better care for patients?
That's the million-dollar question some perspectives raise. The argument is that clinicians need to be aware of intense gaming anyway, and how it might connect to underlying issues like depression or anxiety, regardless of a specific gaming disorder label.
So you can address the underlying problems without needing the GD diagnosis itself.
Potentially. Now, practicality does come up sometimes. A diagnosis is needed for treatment funding or access.
The insurance issue.
Right. But the caution is that shouldn't be the main reason to create a formal category if the other evidence isn't strong enough.
So the concern is that formalizing it too soon, without rock-solid evidence that it helps more than it harms, could lead to stigma and maybe not even better outcomes.
That's the essence of the argument for caution, yes. Basically, let's wait until the evidence clearly shows the benefits outweigh those potential societal and public health risks.
Wow. Okay. We have definitely covered a huge amount of ground here, from defining gaming disorder to the frankly confusing prevalence data, the complex web of factors involved, the real challenges in measuring it, and the still early days for treatment research.
Right. It's clear this isn't simple. And for you as medical professionals, you're really on the front lines here. You might see individuals struggling with this in various ways. So understanding these nuances, the definition, the factors, the data issues, the assessment limits, the treatment landscape, it's all incredibly valuable for how you approach it.
It really hammers home that it's about so much more than just counting screen time hours, doesn't it? It's the impact, the vulnerabilities, the game dynamics themselves.
Exactly. And all this complexity, it leaves you with a really important question to think about for your own practice. Given everything we've discussed, the nuances, the ongoing debate about classification, how can you best talk with patients about their gaming? How do you do it in a way that's clinically helpful, that identifies potential problems and offers support, but also avoids those potential pitfalls, like inadvertently stigmatizing someone?
That's a powerful question to sit with. A real challenge for clinical practice. Thanks for joining us on this deep dive.